go. Hello and good afternoon, everyone. My name is Alexis, and today I want to talk about something I find extremely important. Not only as a parent, but it should be important to us as members of society. And this topic is childhood vaccination. This is not just a political issue, it's a public health issue, one that affects our children, our schools, our communities, and yes, even our future. I want you to imagine something heartbreaking. A parent in a hospital watching their child fight for their life against a disease like measles, whooping cough, or polio. These aren't just words in a history book anymore. These are diseases we nearly eliminated, and now they're coming back. Why? Because some parents, despite having access to life-saving vaccines, modern medicine, and even free healthcare through the state, refuse to get their child vaccinated. And listen, I understand. I've been there. I'm a parent. I have stayed up all night asking Dr. Google what kind of autism my child will have because of the rubella vaccine, which didn't even know was a thing until I was pregnant, by the way. But the more I read, I understood that choosing not to vaccinate your child isn't just about your child, it's about everyone else's child in the community. And it's about protecting our neighbors, our grandparents, and the most vulnerable people, such as the people who can't be vaccinated because of their age or medical condition. So here's the problem: vaccine hesitancy. It's become a health threat. In 2019, the US reported its highest numbers of measles cases since 1992. Think about that. A disease that was declared eliminated in the US is now back. And the reason is simple. Too many people are refusing to vaccinate their children. Why? The anti-vax movement. And let's be clear, these aren't mild illnesses. Measles can cause pneumonia, brain damage, or death. Whooping cough can be deadly for infants. Polio, which causes paralysis in children, could be one fight away from returning if we let our guard down. Some people say, well, it's my choice. It only affects my child. But that's just not true. Herd immunity relies on enough people being vaccinated to stop the disease from spreading. If too many people opt out, the shield breaks. The baby next door who's too young for the first shots is now vulnerable. The kid that's in your child's class that has cancer, gonna get that measles. But this isn't just about your child, it's about our community. So where's this hesitancy coming from? A lot of it traces back to misinformation, especially the myth that vaccines cause autism. That myth came from a 1998 study that was later proven false and retracted. The author lost his medical license, but the damage was already done. Today, social media makes it even worse. Fear spreads faster than facts. A viral story from an influencer post can seem more convincing than a post from a doctor or the CDC. And when fear takes over, logic often takes a back seat. That's why people who are not against science or medicine still end up unsure and even scared. So what can we do about it? I came up with 3 solutions. My first solution is education. I think we need to start early in schools and at home. I think we need to start with the mother so she can educate the child. I think teaching young people the science behind vaccines is very crucial. I think letting them understand how vaccines work and why they're necessary, and for parents, healthcare providers must be trained not to just present data, but listen to fears and gently offer facts. The CDC has a program, it's called Vaccinate with Confidence. It's a great initiative, but it needs to be expanded. More communities need to hear these messages, especially those where misinformation has taken root. My next solution I came up with is policy. I think we need a better vaccine policy. Some states still allow personal belief exemptions due to religion that allow their child to skip their vaccines. But evidence shows that states with stricter vaccine mandates not only have higher vaccination rates, but also have lower chances of getting bad illnesses. So this isn't just about taking away your freedom. It is nothing about taking away your freedom. It's about protecting public health, schools, and daycare centers. And I believe that schools and daycare centers should also require vaccinations, not as a punishment, but as protection for everyone inside. My third solution I came up with is access. I think we need to allow there to be better access to vaccinations. It's easy to just say, get your child vaccinated, but for some families, it's just not that simple. They might not have regular doctor, reliable transport, and time off of work to get to a clinic. And sometimes a woman will give birth, the baby will be completely healthy, and that baby won't even go to the doctor until they're a year old. Women are very strong. So I believe that programs like Vaccines for Children, which offers free vaccines to families who qualify, are essential. We also need more mobile clinics, school-based vaccination days, and a local outreach, especially in underserved and rural areas. No parent should have to choose between feeding their family and protecting their child's health. Even from a sociological perspective, this is bigger than a personal choice. According to my textbook for my textbook for class, social norms help maintain stability in society. Vaccination is a norm that supports community health and safety. When people reject it, they're not just opting out of a medical procedure, they're rejecting a shared responsibility that can lead to a social strain, mistrust, and a breakdown of cooperation in public systems like schools and hospitals. So here's the truth. Vaccine preventable diseases are making a comeback, not because vaccines don't work, but because misinformation is winning. But we can change that. By educating ourselves and others, supporting smart public policy, and improving access, we can reverse this trend. Vaccinating your child isn't just about your household, it's a decision that ripples out into your community. It protects the kid down the street, the teacher at school, the elderly neighbor next door. It's more than a personal choice, it's a public duty, and together we can make that choice for a healthier, safer world. Thank you.